Well, today's rally comes after the state reported that more than 13,000 people have been infected with coronavirus and 738 Washingtonians have died. Just over 157,000 people, though, have tested negative for coronavirus. There's a movement on Facebook supporting Governor Inslee's stay-at-home order. And to show this support, some people held a virtual rally today. So instead of hitting the streets and marching, organizers urged supporters to post pictures of themselves staying at home. More than 33,000 people responded to this event by posting pictures of their backyards, their living rooms, using the hashtag #StayHome. Now, if you remember, just last weekend, hundreds of people showed up to rally in Olympia for the complete opposite reason. These protesters demanded the governor reopen the state. The stay-home order appears to be working in Snohomish County. On a video call with reporters, county officials discussed what has to be done before the county can reopen. County Executive Dave Summers answered a question, though, about other public officials not enforcing the stay-at-home order.
This, in my view, is dangerous and irresponsible. These stay-at-home measures are working. We have flattened the curve. Our medical system currently can handle the COVID cases that are coming up, but if we loosen up without protective measures and the ones I described earlier with PPE and social distancing, if we don't do this smartly, we're going to be right back in the same boat.
The county executive also says Snohomish County will need to improve its contact tracing. Nearly 1 million unemployment claims are expected to be filed in Washington by Monday morning, tomorrow. And the state's Employment Security Department says it is working to meet this demand, but the process can be confusing and overwhelming for many people who are applying for assistance. So they say they're working to simplify this unemployment process for us. The department says it's staffed to take calls, but they're noticing that most people have a lot of general questions, too. So they're now suggesting that people first check their website to get those answers.
And so my group, and working in partnership with other parts of the agency, developed a new front page to our website that has some different boxes to be able to try to direct people directly to the information that they need.
So if you plan to apply for unemployment beginning tomorrow, here are a few tips right from the department. File late at night or early in the morning. Double and triple check your application. The department says the most common issues people have, they're clicking the wrong button and then some follow-up work is needed, and that just takes time. So again, remember to double check your application before you hit send. And while they prefer you to use the website, you can try submitting an application over the phone during off hours. For that, they suggest you call after 6 p.m. Well, people in Washington who do not have insurance are getting some relief during the coronavirus pandemic. Governor Inslee and the state health department added a special enrollment period for those who are uninsured right now. The Washington Health Plan Finder will determine if you can apply for coverage. People who are uninsured have until May 8th to choose a plan. The federal government's plan to reopen the economy is being done in phases, and many were a little surprised to learn this week that gyms might be among the first non-essential businesses to reopen. Now, although fitness centers are a contact-filled environment, lots of people touching things in there, gym owners believe between cleaning and social distancing, people can stay safe.
Everybody's going to be very conscientious of how they clean their facilities, and so this is probably going to be the cleanest that any gym has ever been.
Even if the federal government does allow gyms to reopen soon, ultimately the final say of whether to implement the plan will be left up to the governors. White House health officials are warning Americans tonight to prepare for social distancing measures through the summer as the country's coronavirus death rate continues to rise. Health officials say they need more sophisticated testing to keep people virus-free. NBC's Jennifer Johnson reports from Washington.
White House officials urging caution as states start to reopen, saying the country needs new technology to better screen Americans.
We have to have a breakthrough innovation in testing. We have to be able to detect antigen rather than constantly trying to detect the actual live virus.
Dr. Burke says that could be months away, but protesters are still demanding to go back to work, fearing personal bankruptcy more than COVID-19.
It's been 5 weeks, and most people, even with thousands of calls, cannot get through to unemployment. They don't know what they're going to do.
Tests and personal protection equipment for those on the front lines still desperately needed. A shipment of PPE just arrived in South Carolina from China.
This pandemic has been a wake-up call to America. How much our supply chain on the medical side has gotten out of our control.
The Pentagon says it will be ramping up testing for those in national security from 7,000 a day to 60,000 by June. Meanwhile, governors are now battling a new problem, an uptick in calls to poison control centers after President Trump suggested injecting disinfectants into the body could be a treatment for COVID-19.
When the person with the most powerful position on the planet is encouraging people to think about disinfectants, whether it was serious or not, people listen.
President Trump said he was being sarcastic, but has held no coronavirus task force briefings all weekend after facing backlash. Health officials are warning people there is still no proven treatment or cure for COVID-19. Jennifer Johnson, NBC News, Washington.
In the UK, British Prime Minister Boris Johnson will be back at work tomorrow following his hospitalization and his recovery from coronavirus. Britain's Foreign Secretary, who has been filling in for Johnson, said the Prime Minister was, quote, raring to go. Johnson spent a week in the hospital, including 3 nights in intensive care, where he was given oxygen and watched around the clock by medical staff. An expert on North Korea says he believes the country's leader, Kim Jong-un, has a health problem right now. Robert Kelly, a political scientist at a South Korean university, made the comments today amid growing speculation about Kim's medical condition. Rumors of a health problem emerge after Kim missed the birth anniversary of his grandfather, North Korea's founder Kim Il-sung, on April 15th. He hasn't been seen since then, and there are indications that he has left the capital.
Well, my guess is, since we haven't heard anything from the North Koreans and the pressure has been building, there's been media discussion of this now for several weeks or 10 days. My guess is there's probably something wrong with him.
Kelly said if Kim died, then his sister would be the obvious choice to become leader, as Kim's kids would be too young.